Today's session will focus on how states and communities are using science to address PFAS. Our goal for this event is for state participants to hear best practices for addressing PFAS contamination and protecting public health. We will also explore environmental justice considerations in addressing PFAS, and towards the end of today, we'll have small group breakout discussions focused on PFAS and biosolids, pollution prevention, and PFAS destruction and disposal methods. The issue of PFAS in drinking water is important to governors since it impacts public health, water affordability, and can have significant economic impacts on states since clean water is an essential resource. Our hope for today is that state water and health policymakers learn from each other and leave this event with ideas for how to address PFAS concerns in their given state. Thank you again for joining us here today. I'll now turn things over to Rebecca from AAAS.
Wonderful, thank you. Thank you to the National Governors Association for partnering with us. And thank you to all of you for attending, as well as our speakers today. For those of you that joined us last time, I'll give a quicker introduction to the AAAS Epicenter, and we'll get right to the important parts with our experts and speakers. So just as a reminder, the AAAS Epicenter is an effort part of the American Association for the Advancement of Science. And we're working to bring clear, concise, and actionable scientific evidence to decision makers at all scales: local, state, regional, and federal. We work on a number of different issues. If you want to go to the next slide, including PFAS in drinking water, orphaned and abandoned oil and gas wells, voting technology and election security, green stormwater infrastructure, artificial intelligence related to the pandemic response, as well as some risk assessment tools in the judiciary, substance use disorder and treatment, and starting some work on structural racism and policing. Today, we're here to talk about the work we've been doing on PFAS and working with local, state, water and health advisors, as well as elected officials. So the AAAS Epicenter has created a set of guides that we have shared with all of you that is really geared to help share some of the scientific information that we know about PFAS, as well as some sampling and monitoring, treatment and remediation, and risk communication. So we hope that you'll be able to check out those guides and use them to help in furthering your understanding of PFAS and leading to additional questions and efforts around addressing PFAS. We also work to bring scientists, engineers, and policymakers together to work on this important issue. And so this is one of those opportunities in which we hope that we can provide an opportunity for folks to really have a discussion and think about what their questions are and how some of these other experts can help address those questions. So with that, I will pass it over to Maya to get started on the actual presentations.
Great, well, thank you, Rebecca, and to the AAAS Epicenter, Jessica and Bevan, and the National Governors Association for organizing this session. As Rebecca said, my name is Maya Breitberg-Smith, and I'm with an organization called Resolve, and we'll be helping to facilitate today's webinar. Really excited to see so many participants in the room today. You know, one of the nice things about being in Zoom meetings rather than Zoom webinars, as we were last week, is the ability to kind of scroll through and see so many names and folks online today. So just as we're getting started here, I will go through the, I'll briefly run through the agenda for today's session, and then just share a few notes about how we're using today's technology, and then jump in because we have a lot of great things lined up for today's session. So as Jessica mentioned, we have two sessions today with speakers and then the breakout session. So the first session, we have three speakers, Gloria Post, John Alley, and Barbara Morrissey, who will each talk about, provide some information on how states are responding throughout the US to PFAS contamination. After their presentations, we'll have a few minutes for facilitated discussion before we move on to the second session for today, which is focused on how PFAS in drinking water is impacting communities. And particularly, we'll hear about a story of in North Carolina in an impacted community there. We have Professor Lemecia Whittington, who will talk to us about that story, as well as the EJ concerns and potential recommendations to support those communities. We will also have time for facilitated Q&A after that presentation. And then we'll move into breakout discussions. And I know for those of you, I'm guessing everyone registered for the webinars, and when you did so, you were asked to select which breakout session you'd like to participate in. Well, actually, that was really informative for us as we're planning for the sessions, but you'll have an opportunity when we get to this part of the meeting to choose which breakout session you'd like to go into. And we have, as Jessica said, 3 topics: biosolids, destruction and disposal, and pollution prevention. And it'll really be an opportunity for kind of increased interaction and dialogue around how different states are considering and addressing these issues, where there are successes or progress, where there have been challenges, and what additional information or science might be needed to support action. Well, after those breakout sessions, we'll all regroup, hear quick report outs, very brief report outs from the group's discussions, and then wrap up by 4 o'clock Eastern. So that is the agenda for today's meeting. A couple of other quick technology notes here that I wanted to mention. I see most people, well, I think everybody has their video off now, and that does help us all kind of focus on the speaker and the presenter during presentations. So ask folks, as you're doing now, keep your videos off for the presentations. However, we invite you to turn on your videos to create a little bit more of an interactive environment when we get to the Q&A sessions and the breakout sessions as well. Please go ahead and put any questions or comments you have into the chat pod. We'll draw from the chat pod, the comments we see in the chat to have the Q&A. If time allows, we might invite someone who asks a question to turn on their video and ask it verbally or follow up. And let's see, we are recording the session today. You probably all saw that note when you joined that the session was being recorded. We will not be recording the breakout sessions, just the sessions that are in plenary are being recorded. And appreciate, I see everyone is on mute, so thank you. It seems like everyone's kind of gotten that message over the last year plus of plenty of Zoom meetings, but thank you, that helps to minimize distractions. So with that, I think that's the housekeeping, all the housekeeping from me that you might need. And with that, I think we can go ahead and move on to the first session, and I will stop sharing my screen and invite Dr. Gloria Post, who is our first presenter for this first session about how states are responding to PFAS contamination, to turn on her video and start sharing her screen. And while she's doing that, I'll just introduce Dr. Post, who is a research scientist in the New Jersey Department of Environmental Protection, Division of Science and Research, where she's been for more than 35 years. So Gloria, with that, I will turn it over to you. Thank you.
Okay, thanks so much for inviting me to speak today. My talk on state and EPA drinking water guidelines for PFAS is going to be a summary of a longer talk I gave at the CTAC PFAS International Conference in 2019 and a subsequent publication in environmental toxicology and chemistry based on that talk. My paper is open access, so my last slide does have a link to the paper and some other resources if you're interested in more detail on this subject. So just to start off, why are PFAS of so much concern as drinking water contaminants? Why are we hearing so much about them in drinking water? I'll try to quickly summarize this important question. The answer, there's widespread occurrence. They do not break down in the environment. That's why they're referred to as forever chemicals. They have numerous toxic effects in animal studies. The long chain PFAS, such as PFOA, PFAS, and others, bioaccumulate and remain in the body for many years after exposure ends. There's evidence for human health effects, even at general population exposure levels, even in people not drinking contaminated water. There's associations with health effects. Importantly, to answer this question, that is the title of the slide, there's higher exposure from drinking water at low levels, such as, for example, 20 parts per trillion for PFOA. The exposure from that low level in drinking water with ongoing use is higher than the other exposures we get from generally prevalent sources such as food and consumer products. Infants are a sensitive subpopulation for health effects, and they have higher exposures from contaminated drinking water than older people. So overall, all of these factors indicate a need for caution from drinking water exposure. In this talk, I'm referring to EPA and state guidelines for drinking water contaminants. I'm using the term guidelines to refer to both standards, enforceable standards such as EPA and state maximum contaminant levels, and guidance values which may not be enforceable. For example, EPA health advisories and other guidance values that states may establish. So in general, as far as state drinking water standards and MCLs, there's been a lot of attention on states establishing their own MCLs for PFAS in the last few years. But just in general, states may address contaminants with no federal MCLs, such as PFAS. State MCLs may be more stringent than federal MCLs for contaminants that do have federal MCLs. And they can address other contaminants without federal MCLs. Some states have developed their own MCLs for many years. This is nothing new. Since the 1980s, New Jersey, California, Massachusetts, and other states have been developing their own MCLs for some contaminants. For other states, I think Michigan's an example. Some states have developed MCLs for the first time when they developed PFAS MCLs. On the other hand, many states do not develop their own MCLs and follow EPA's drinking water standards. Some of these states may be precluded from doing so by their state laws or regulations, and other states, they may not have the expertise or resources to develop their own MCLs. So this table shows state drinking water guidelines for PFAS, state and EPA, including standards and guidance values, proposed, recommended, and final. I just want to say that ITRC, the Interstate Technology and Regulatory Council, which has a big PFAS team, has a table of current values for state and federal and international guidelines for PFAS that's updated every 4 to 6 weeks. I have the link in my last slide, and that's a good resource to find out the latest information on this subject. So you can see, since there are 10 states that have developed PFOA and PFAS guidelines that are lower than the federal health advisories since 2016. Some states have developed guidelines for other long chain PFAS. Those are the ones on the left, or short chain PFAS, the ones on the right. with the white font. Another important thing to be aware of is that some states for the long chain PFAS, you can see Connecticut, Massachusetts, Vermont. Their guideline is based on the total concentration of the long chain PFAS, the ones in the yellow font on the top. So for example, in Massachusetts, the guideline, I believe it's an MCL, is 20 parts per trillion for the total sum of all 6 of these chemicals, whereas the other states, these guidelines apply to the PFAS individually, and that is a really big factor in implementation of these numbers and what they mean. Other states that are not listed here generally use the EPA health advisories of 70 parts per trillion for PFOA and PFAS. This is a slide showing how PFOA drinking water guidelines developed by states and EPA have changed over time in a decreasing fashion. I'm not going to have time to show the slide for PFOS, PFAS, but you would see a similar pattern for PFAS as PFOA. Please note that the scale on the left is a logarithmic scale, so the numbers have changed by orders of magnitude over time. In the early 2000s, the highest value here from West Virginia is 150,000 nanograms per liter or parts per trillion. And the numbers that have developed by states since 2016 are from around 35 down to the most recent number from Illinois of 2 parts per trillion. New Jersey did have a lower number in 2007. That's more in line with the current numbers of 40 nanograms per liter, but the other numbers were much higher earlier and have come down recently. So this is a slide that I developed for a general audience a couple years ago, just to show an overview of how drinking water standards are developed. There's 2 main factors in the health-based goal. That is the toxicity factor, which is based on human data or more usually animal data. We don't often have human data that we can use as the basis, and the exposure assumptions. How much water do people drink and how much exposure do they get from other sources such as food and consumer products? That's to develop the health-based goal. But to set a standard, other factors have to be considered for a regulatory standard. For example, can current analytical methods analyze it to reach the health-based level? And can current treatment removal technology remove it to below the health-based level? So these factors can be limiting for some contaminants, and in those cases, the standard has to be set higher than the health-based level.
Gloria, this is Maya. Sorry, just to interrupt. You have about 1.5 minutes left. Thanks.
So let me get quick. Okay, so why are there differences among state drinking water guidelines? All states have used the risk assessment approaches and guidelines recommended by EPA, but the guidelines are based on data that was available at the time when they were developed, and risk assessment is not a cookbook. It involves scientific judgment, so scientific judgment can result in different decisions. It's important to realize that the numerical differences among state values are not large or unexpected in the context of independently derived values, and especially compared to the older values that were generally orders of magnitude higher. So what are the reasons that the state drinking water guidelines are lower than the health advisories? The states that have lower numbers concluded that the health advisories of 70 are not sufficiently protective for one or more of the following reasons. They considered more sensitive toxicity endpoints than the health advisory, such as immune system suppression and mammary gland development. Some states modeled the higher exposures of breastfed infants via contaminated water. This is a model developed by Minnesota Department of Health that was not available to EPA when the health advisories were developed in 2016. And some states considered the increase in blood serum levels from contaminated drinking water. And these states have concluded that these serum levels are associated with multiple health effects, the serum levels resulting from ingesting 70 parts per trillion, and this was not considered in the EPA health advisory. As I said before, the other factors are considered in setting standards, not just the health-based levels. And so people want to know why are the standards for PFAS lower than for other contaminants? For PFAS, PFOA, and others, as shown here, PFOA is the example, the analytical factor and the treatment factor does not limit achieving the health-based number, so they are set at the health-based number. Other chemicals here, chloridane and arsenic, are examples. Their health-based numbers are just as low or lower, but the standards are set higher because of analytical and treatment limitations. So other chemicals have similar health-based numbers. This is my last slide. It has resources, the ITRC table. This is a hot link, the ECOS white paper on setting state PFAS standards, and the paper that I mentioned at the beginning, and my email if you have any questions. Thank you.
Thank you so much. Really helpful to hear. I think many folks kind of hear these different numbers and about the different guidelines. So it's really helpful, Gloria, to hear your kind of overview of why states are doing different things, how those numbers are different, why they're different, and this set of resources at the end of your presentation will be really valuable. We will be posting these presentations online as long as that's okay with our presenters, and we'll be sharing that afterwards, so folks will be able to access the resources you've shared. So thank you, Gloria. With that, I'm going to go ahead and invite Dr. John Ali to turn on his video, and I'll bring up your presentation here as we're getting started. And you're an environmental toxicologist for the New Hampshire Department of Environmental Services, where you conduct risk assessments of environmental media for hazards related to chemical contaminants. So welcome, John. Very glad to have you here today. And I'll go ahead and turn off my video. Let's see, John, are you still there?
Yep, still here. So thanks everyone for having me today. So I'm going to have you advance to the next slide. So I'm just going to try to give a high-level overview of PFAS in New Hampshire and some of the process that actually went into our state establishing those standards and some of the hiccups that we had along the way. And then I'm going to highlight some of the multidisciplinary issues and risk communication issues that might arise from developing standards like this. So next slide. So in New Hampshire, our historical event that kicked off our investigation of PFAS was the discovery of PFAS contamination in wells at the former Pease Air Force Base. This occurred back in 2014 when the EPA was doing some drinking water sampling. They discovered elevated concentrations of PFAS, primarily PFOS and PFHXS, related to aqueous film forming foam use at the former Air National Guard base. This is a pretty common source of PFAS contamination, and for a lot of states across the country, they're probably having similar experiences either with Air Force bases, airports, or firefighting stations that have used these foams. This is sort of a new discovery for the state, and at the time there's very little information and no drinking water standard established. So this resulted in a lot of concern from our public groups as well as our legislatures. Next slide. Our investigation expanded when it was discovered that an industrial facility in the southern portion of the state was actually emitting PFAS as a part of their production process. It was a textile coating facility. And in this process, they would emit from their stacks PFAS, especially PFOA, and this would be transported by wind, deposited on the ground, and gradually percolate into groundwater supplies. And given the persistence of PFAS and PFOA in the environment, this has led to a pretty widespread area of groundwater contamination. So this compounded our the investigation from P's earlier, and the state realized we had a significant issue with this and started doing some testing. So next slide. So what's probably of interest to some folks on this call is the legislative response. So in 2016 was when the EPA released their lifetime health advisory of 70 nanograms per liter combined for 2 PFAS compounds. And we adopted that as an emergency groundwater standard. In the interim between then and 2018, there's a lot of work done to either deliver bottled water to impacted residents or make connections to public water. We also did a lot of sampling, because what's important to understand with PFAS is, if you're not looking for it, you may not detect it. And there's a lot of maps out there on the internet right now that show the occurrence of PFAS in certain states. And a lot of these are biased to states like ours that have done a lot of sampling. So when you see some states that do not have a lot of hits, it might not be because there's no PFAS. It may actually just be a lack of testing in that area. So our state agency also worked with the Air Force to try to look into treatment at the Peace wells, but also dealing with some other issues across the state and identifying responsible parties. In 2018 was when our legislature passed a bill, Senate Bill 309, that basically made 3 requests of our agency. One was to establish drinking water limits, or MCLs, for PFAS compounds in specific. And in New Hampshire, our MCLs also act as our ambient groundwater quality standards. They have a kind of complicated relationship that I can get into during the Q&A period. So this is sort of a unique ask for our agency. And one of the resources that our agency needed was staff, including a toxicologist and risk assessor, which created my position, as well as another staff member that sits in our program who helps with the risk assessment of PFAS, not only in drinking water, but in other media. It also gave us the authority to regulate air to groundwater pollution sources, which in retrospect seems like an obvious thing that should be done, but our agency didn't have the authority at the time to regulate that. So with that, we're now regulating the sources of those air emissions that could be impacting groundwater sources. And then the final part of this that was a little unique was we were not asked to set a standard, but we were asked to develop a plan and budget for what it would take to regulate PFAS in surface water. Because if you start regulating drinking water and groundwater, it only makes sense. You need to start looking at other places that these compounds might go, and that includes surface water sources. So we went through an extensive public comment period with this. When we developed draft versions of the MCLs, we put those out for public comment, had multiple stakeholder sessions, and engaged with community advocacy groups, the regulated community, legislatures, and especially the communities that were impacted by these contamination issues to really understand what information were we missing or what were we not considering that they all thought was important. This legislation also required us to look into the cost and benefit analysis of what would it cost to achieve some of these standards. And we do have a full report on our website that's available for anyone that's interested. After we adopted those standards in 2019, they were temporarily stayed due to litigation against them brought forward by a local water district in partnership with 3M. In court, the standards were temporarily enjoined, so our agency could not enforce those. So I believe last week on one of the presentations, our standards were listed as being unenforceable, and that was probably a conception from what happened with the 2019 litigation going into 2020. However, in 2020, as a part of some omnibus legislation, the Hampshire State House, Senate, and Governor's Office signed off on actually codifying our MCLs into law, and now we have enforceable MCLs and drinking water standards. But in addition, the same omnibus legislation made it a requirement that insurance companies have to cover PFAS blood testing within our state, but it also created a $50 million loan fund to help municipalities and public water systems meet these standards, because it is possible to treat for PFAS, but it's not cheap. So it was one of the things that's needed to help with this, is to address the challenge of actually putting on treatment for a lot of systems. Next slide, please. So those are our standards. They were developed for a very specific group. As Gloria mentioned, there's a lot of exposure factors that go into this. A full link is available, or full link for the document is available down here, and I'm happy to answer any questions. But for the sake of saving time, I'm going to go ahead and just have us roll on to the next slide. So part of our testing initiative that is ongoing is looking to see where PFAS are, not only in residential wells, because in New Hampshire, about 47 to about 48% of our residents, I believe, are on private wells. So that's a lot of our communities that are impacted. We also realize PFAS may be coming from other sources. So either industrial sources, online landfills, places like that, even Superfund sites that may be existing sources of PFAS to groundwater supplies. This is a map provided by some of my colleagues, Brandon Kernan, Derek Bennett. If anyone would like more information about the data that we have available or more mapping information, please contact me and I'll connect you with those too. Next slide, please. One of the things that our experience in New Hampshire has really taught us is it's important to think about some of the communities that'll be impacted. So for states that have a lot of residential well users or people that'll be on private wells, it's important to think about how you're doing risk communication with these individuals, because we cannot force them to comply with our standards, but at the same time, rolling out a new standard for a chemical they've never looked for. You may have people that have been using their private well for 30 years, and this week we're sending them a letter to say, stop drinking your water, it's contaminated. And we need to do that because if we detect PFAS there, we need to protect health and reduce their exposure. But we also have to be mindful about how does that communication go out and what are the uses? These standards are designed for being drinking water standards. So when we tell a private well user to stop drinking the water, does that also mean stop bathing, stop cleaning, stop using all water in your household and come up with a way to use bottled or alternative water for that? What kind of treatment systems do we recommend? Do we recommend point of use or whole house systems? And people even want to know what's their individual risk if they've been drinking this for years, or how long has the chemical been in the water? And your state agencies may not have answers to those, especially the history of the contamination, but it's important to understand how you will respond to those and what information you might need. We also have the challenge that people want to go to their physicians to get information about what is their exposure due to their health. And right now, most physicians don't even have an understanding of what PFAS are, what environmental exposures may mean for health. So there's a lot of challenges in risk communication with this. We do have a lot of information on our website. It's listed right there. I highly recommend you go see it. We also have recordings of several public meetings that we've held in these towns. Lots of information is there. I really, really recommend checking it out. Next slide, please. And I know this meeting is about drinking water, but I think it'd be remiss to not talk about how PFAS interacts with other media and impacts it. It's proven to be a real challenge for waste management systems, and it's really important to think about how drinking water, groundwater standards might impact those rules and regulations within your state. It's also important to think about how do we handle new and emerging compounds, novel PFAS, their breakdown products. What do those mean for risk? How do we designate cleanup for those? But we also get questions about other environmental media, fish, shellfish, game, irrigated crops. If someone has a contaminated well, what level do we tell them to stop irrigating their home garden? And again, that's something that's not part of the calculation of a drinking water standard. That's a different type of risk assessment. And finally, for some states, this may include challenges for surface water, which may serve as a source of drinking water. But when we also think about the fate and transport of PFAS, this is another area that needs to be addressed. And we still don't have a lot of information, not only on fate and transport, but potential risk to wildlife and protected species. Next slide, please. So with that, that was pretty quick. That's my contact information. I am happy to talk all afternoon on the phone about any questions that you have and connecting information that's available. And with that, I'll turn it over to the next presenter.
Thanks, Jonathan. Really appreciate you sharing that story of New Hampshire and kind of how that kind of PFAS contamination kind of has appeared, those sources, as well as how the state has gone about working to set MCLs and those other sources. So we will move on to our next speaker, and I'm going to bring your presentation up here. And our next speaker is Barbara Morrissey, who's a senior toxicologist and science policy advisor at the Washington State Department of Health. She led development of recommended values for state action levels and is a lead toxicologist and a policy advisor for the Washington Department of Health in developing a statewide chemical action plan for PFAS. And so Barbara, thank you. I'm I invite you to turn on your video, and looking forward to your presentation.
Yeah, so can you hear me?
I can, yep.
Good, great. Well, thanks for inviting me to join you today. It's always wonderful to hear what my other state counterparts are up to. So great presentations, Gloria and Jonathan. So today I'm going to be talking briefly about some of the pollution prevention tactics that Washington State has been taking in response to PFAS. Next. So just to spend a little bit of time on like, what is the problem with PFAS? Just a quick review. Like many other states that have started looking for PFAS, our state drinking water supplies are known to be impacted in at least 5 areas. And 2 of these areas actually have fairly high levels of contamination, over 1,000 parts per trillion of PFAS combined in the drinking water supply. And the primary source suspected at each of these sites is firefighting foam. And when we look more comprehensively, as Jonathan suggested, we may find other sources. Next. So where PFAS are in drinking water supplies, it creates a number of problems. Depending on the size of the water system, we may have a complex government response needed with emergency community meetings, obvious restaurant closures, a large mix of agencies involved. There's the burden on the community. There's the stress of waking up to find that you have a contaminant in your tap water, disruption of daily life if bottled water delivery is involved, concern about health impacts. And then there are financial burdens. If you're a private well owner, you may be on your own to test your water, depending on what kind of state or local help is available. And PFAS are costly to mitigate in drinking water. Both the initial mitigation and long-term solutions can run in the millions of dollars. And remediation methods, we haven't talked about that at all yet today, but those are actually still being developed and tested. So the costs are a little bit uncertain. There are some promising technologies coming along that may destroy PFAS. So that will be great if that comes through. And then lastly, the legal structure for recovering costs from responsible parties for these cleanups is really hampered by the fact that the federal government hasn't designated PFAS as hazardous substances and hasn't regulated them under the Safe Drinking Water Act. Next. As Gloria mentioned, Washington is one of the states going ahead with state drinking water standards for PFAS. I'm just going to say a couple things about this, but we are proposing state action levels for 5 PFAS in drinking water. These SALs, so we call them, are like a mixture of enforceable requirements and public health advice. So they would require Group A water systems to test for PFAS. And then they contain requirements for public notification and follow-up monitoring. And then they also provide our best advice for when to take action to protect the health of communities over the long term for consumption of tap water. And these are kind of a bridge to an MCL because this comprehensive water testing is going to help us identify other water systems that are impacted and provide the data we need to develop a state MCL. We are not one of the states that has done that in the past, so we've also had to define the process that we're going to follow to do that. So we're a little bit behind of New Hampshire on that and New Jersey. These SALs are in rulemaking as we speak. And that is a process being carried out by our State Board of Health and are expected to be complete by the end of this year. And then lastly, these are our 5 proposed SALs. Next. So I want to start talking about a kind of a special program we have here in Washington that are called State Chemical Action Plans. We've developed these since 2003 for persistent bioaccumulative and toxic chemicals. So this is our PFAS, are our 6th chemical action plan. We call them CAPs. And this program was developed because of the need for coordination across many state programs to deal with contaminants that cycle through many media, persistent, bioaccumulative. They're moving through water, air, biota, etc. And this process has a very robust stakeholder and public input process baked in. So apps don't ban or regulate compounds, but their recommendations can be adopted as state policy and can lead to legislative action. Next. So this long-term partnership between two agencies in Washington, so our State Department of Ecology, State Department of Health, and many stakeholders, has really been important support for our state action on PFAS cap. And here I just listed some of the different programs that have all come together to do the assessment that was needed for what is the problem with PFAS in Washington. They've gone out and done water testing, they've done biota testing, fish testing, and then come together and try and work with stakeholders to develop recommendations. And the CAP process has been incredibly helpful to us to facilitate conversations across multiple state agencies and programs and with multiple stakeholders. And it's really like a problem-solving unit. So some of the recommendations that have come out of this CAP process are, ensuring safe drinking water. That includes like expanded testing to understand the scope of the problem, supporting the development of state drinking water standards to protect health, establishing congruent cleanup standards, designating PFAS as a hazardous substance so we can get them into the legal framework in our state, and help find funding to help water systems defray the upfront costs. But there's also other recommendations in terms of reducing PFAS in products, managing waste streams, and further study. Next. So just want to take just a quick step back and just look at how the CAP kind of takes a holistic view of PFAS problems. So we're looking at the whole pathway of exposure in places where the state can intervene to address problems. So next. So these are some of the tools that states use to, to reduce exposure. So drinking water standards, fish consumption advisories, advisories for consumption of livestock or game. Those are all acting fairly late in the process. Next. We may also issue, risk communication to the public about how to manage PFAS in their home or their water, how to read labels and avoid purchasing. Again, these are fairly late in that exposure pathway. Next. So one of the things, and you can hit next 2 more times, that we've really looked at is how can we intervene farther up in the exposure pathway so that we can act before harm has occurred and before we have a huge price tag in our state to deal with PFAS that are accumulating in waste streams, in the environment, in our biota. So the CAP makes a number of recommendations for acting more upstream, and 3 different laws all have been passed in Washington that I'll tell you about in just a second, that all act higher up in this pathway. So one is a ban in PFAS in food contact paper. Another one is the Safer Products for Washington, which is going to look at other consumer products. And then the ban on PFAS in firefighting foam. We know this has been a problem in Washington, and trying to prevent further releases of PFAS containing firefighting foam into the environment was a key recommendation. Next. So 3 laws that I'm going to briefly touch on. The first bill was passed in 2018. It bans PFAS as a class in food contact paper, provided that safer alternatives are identified and available. The class approach really came out of the recognition that the PFAS replacements in food paper were mobile and also very persistent. There was emerging evidence that some of the PFAS replacements also have toxicities of concern, and lawmakers were just concerned that the replacement PFAS didn't have sufficient information to demonstrate safety. So this bill required the Department of Ecology to do a safer alternative assessment. They wrapped that up this year and found alternatives for 4 categories of food papers. So that ban will go into effect in February of 2023, and they're continuing to look at other types of food paper. Next. The second bill here. Second bill also passed in 2018 and bans had 3 parts. Bans any kind of training, firefighter training with PFAS containing foams, and that went into effect immediately and also covered military bases. The second part was to ban PFAS in foams starting in 2020. There were 4 exemptions for military, FAA airports, and certain chemical plants and oil refineries. But those exemptions were later replaced with extended timelines for compliance. And then the last part of this was that manufacturers and sellers of PFAS-containing firefighter equipment, like PPE, have to notify firefighters in writing if that equipment contains PFAS chemicals and the reasons. Next. And the last thing I want to talk about, and I'll talk about this a little bit more in our pollution prevention breakout, is a law that was passed in 2019. It's being implemented as the Safer Products for Washington law. And it basically provides authority to our Department of Ecology to take a broader approach to weed out harmful chemicals from consumer products and supply chains. And the law names 5 classes of harmful chemicals and directs the Department of Ecology in consultation with my department to identify priority products for each class and to consider regulatory actions on those priority chemical combinations. And right now we are in phase 3. So we have identified priority products for PFAS. Those include carpets and rugs, leather and textile furnishings, and aftermarket stain and water repellents. And now we're in the phase where we're looking at safer alternatives and determining whether regulatory actions are warranted. And the last stage, phase 4, would actually be rulemaking. And then at the end of that, we start all over with another 5-year cycle, naming up to 5 new priority chemical classes. Next.
And sorry, Barbara, just to flag that we've hit the 10-minute mark, and so just want to.
Yep, I'll be super quick. This is my last slide. I just wanted to reflect briefly on why we've had these policy successes in Washington. We do have a pretty robust group of NGOs. We had firefighters and water systems and empowered citizens come and testify on these bills. We also had, as I mentioned, the Chemical Action Plan, which had a lot of the science assessment and recommendations to support action. And some of the arguments that were successful were just that need to act because of the lack of federal regulations, reducing non-essential uses when safer alternatives are available, moving upstream in our solutions, and this idea of this class approach to reduce regrettable substitutes. So I'll just finish up there and we can talk more in the question and answer. Thanks so much.
Great, thank you so much, Barbara. And I believe Denise in the chat was asking me if I promise to show the state action levels on the screen again. So I will. I think we hit them pretty quickly. So I'll put those back on the screen for Denise and others who are interested in seeing that information. And I think we probably have time for one question before we move on to our next session. So just if we, I invite John and Gloria to turn on your videos here. If you would like. And then just as we're identifying what that kind of that question is, I did want to flag in the chat a few other comments and thoughts from folks. So first from Tanny, they flagged that Minnesota did a study of irrigation of home gardens, I think related to a point that you raised, John, around kind of communicating with constituents around that garden piece. And there's this person indicated, Tanny indicated that the benefit of a large selection of vegetables outweighs the risks from PFAS contamination. And there's a link to the study from Minnesota in that chat. And then I see, John, you also put a link to the New Hampshire PFAS investigation in the chat as well. So thank you for sharing that information. And so just a question for the panelists around the cost of a state setting MCLs. I think there's as I think we heard Gloria and others say, and Barbara, I think you mentioned this as well, there are some states who do have MCLs, some states like Washington that are moving towards MCLs, and John, New Hampshire has that. So what are the, if there's anything you can share about the costs of setting a state MCL, that might be informative to others who are thinking about that.
I'm not really in New Jersey. Our rulemaking process includes cost estimate, but not formal cost benefit. And I'm not really prepared to talk about that or what other states have done in regard to cost.
Yeah, so I just throw in, I know we've been asked this a couple of times and our state has tried to put, I don't know the actual number off the top of my head, so I'm sorry for not having the number. But as far as, I think you're asking the cost of having the agency put staff time, resources, and research into developing a standard versus the cost of implementing a standard and the cost to like public water systems to meet that standard. So that latter part, our state did do a cost benefit analysis of what's the impact once we roll this out and you have X% of public water systems that need to meet this standard. What might they be running into when you start thinking about the cost of putting on treatment, and that you need to also account for other contaminants because that might affect the type of treatment technology you can use. On our website, we have that. It's probably going on 2, maybe 3 years old now. So the numbers might not be up to date, but for those that are interested, it would at least give you a framework of things to start thinking about, and you could just update some of the values. But I know we have been asked by other states, as far as things like we had to hire 2 additional staff to do the research, do the work to develop the standards. And then there was the time of other administrators, other staff from our agency going to public comment, receiving those comments, reviewing the information. I think that's something like our agency could share that if there are other states that were interested in this, but it is something worth considering. But it's also nice because as we go on, you have other states, like for example, we built a lot of what we did off of the backs of New Jersey, Minnesota, those other states that have been dealing with this longer than we have. So there is an advantage of coming in a little bit later to the game because we have all that experience we can build off of that. Fortunately, they've spent all that money, but it just would depend where the state is.
I also want to add, I believe that the ECOS white paper on state PFAS standards and guidance that's linked from my PowerPoint, I believe it addresses like how much the question of the resources and costs that states needed to do this in that white paper.
Oh, great, thanks. Okay, I do want to take one other question from Denise in the chat, and then we'll transition to our next session. But Denise asks about the most significant contributor to differences in levels of concern between states and the federal government. Is it the tox endpoint? And so, Gloria, I wonder if this is something that you might be able to address.
I didn't have time. One of my slides was intended to convey that, but it's a lot to do in a short time. Yeah. Basically, both when you do the health-based standards, which most of these numbers are, they are health-based, they're not set at higher levels, analytical levels. Both the toxicity endpoint and the exposure assumptions can make big differences in the numbers. Most people don't appreciate that the exposure assumptions can be just as important in these differences as the tox endpoint. My paper has detailed tables for both exposure and toxicity for all of the states and the federal that were available at the time, and except for the most recent ones. It's based on both more sensitive endpoints of toxicity that some states use, many states use for PFAS. The immune suppression has been used by quite a few states, and that occurred at lower levels than the developmental endpoint EPA used. Delayed mammary gland development for PFOA occurred at lower levels, but also states are considering this Minnesota model that accounts for the higher exposure of breastfed infants to PFOA and PFAS. It's multiples higher than older people, and that model was not available to EPA. It actually wasn't available when New Jersey did its standards, but to my knowledge, all of Minnesota used it, and then all of the states that came after them, or most of them, have used it. New Hampshire, Michigan, and Minnesota, and Washington, I believe, and that makes the numbers quite a bit lower too. So it's both tox and exposure.
Mm-hmm. Thank you very much, Gloria, and thank you to our speakers. Really appreciate, we asked you to do a lot in a short amount of time, so really appreciate you sharing these stories, sharing this information with us today. And with that, I think we will go ahead and transition to the next session. And as we're transitioning, I would ask Jordan to please go ahead and pull up the poll that we have, just looking for a little bit of information, informing some of the next steps. Would love to get some information from the audience, or input from the audience, around the aspects of addressing PFAS that you would like to learn about more from other states. And so a number of options there. And as we're transitioning, invite you to ask you to share your input to that poll. Thanks. Okay, and as we're transitioning, I'll just introduce the next session as you're all responding to that poll there. I see we've got about 47% of attendees who have responded. So I've got 50%. I think we can get a little higher. So our next session is focused on PFAS impacts in communities and environmental justice concerns. And we're really very pleased to welcome Professor Lamicia Whittington, who's a professor in the Division of Sociology at Meredith College. And she also serves as the Deputy Director for Advanced Carolina and the Campaigns Director for North Carolina Black Alliance. And Lamicia is going to share a little bit about the story of an impacted community with that focus on environmental justice concerns. And so Lamicia, I think we'll go ahead and end polling now and invite you to share your screen to start your presentation. Thank you.
Thank you, Maya. Good afternoon. I'm bringing my screen up now. Definitely great to be here in the space. Okay, wonderful. So as Maya already stated, my name is Lamicia Whittington, and I am a professor. I'm also a director, but I wear many hats as an Afro-Indigenous woman from North Carolina. I also serve as the community liaison for the National Academies of Science on their recent and ongoing study of PFAS and how we are setting clinical guidelines and recommendations to the CDC, as well as a co-petitioner in 3 lawsuits to the United States EPA. 2 on PFAS, 1 on existing 54 PFAS chemicals, and actually getting that appropriate testing, but also regulatory enforcement around Chemours, which is our plant corporation in North Carolina. The second lawsuit is around emerging PFAS and trying to impede the exposure of new PFAS in consumer products in North Carolina. Our third is actually around 1,4-dioxane, which actually connects to PFAS in a different way, but we're not discussing that today. So my analysis in our snapshot will include a landscape of North Carolina, but it is applicable to communities across the nation, and exactly how are we reaching environmental justice communities. That includes Black, Brown, people of color, and low wealth populations, right? And so when we're talking about those populations, it's looking at the cumulative impact and the many pathways of exposure to PFAS, and how we are identifying what are the cumulative impact, the many ways, the pathways to exposure, but how are we addressing adequate testing, equitable outreach? What does that look like with the same policy that you've actually heard from recommendations around MCLs in the previous presentation, and other ways to research pathways to exposure? So this is where we will journey today for my talk. Is just, again, that was the introduction, but Black and Brown populations impacted, but this also includes low wealth populations and also rural communities, a hyper focus. The potential health effects we are dealing, of course, as we have already discussed here, around the health disparities that have been exacerbated due to exposure to PFAS, but what are the many layers in which our folks are exposed, and where do we need adequate testing? Where do we need policy to actually speak to unincorporated areas, unregulated areas that are on unregulated utilities? We've already spoken about well water, but oftentimes resource allocation from the state budgets, right? Resource allocation for local governing bodies oftentimes miss the full breadth of the need for research, which oftentimes alienates certain special populations. Next, we'll talk about the value in testing our community members. I'm already laying that groundwork now. And of course, some medical support needs, again, talking about those clinical guidelines and what that looks like. My introduction has already been stated, but again, Professor Whittington, and these are the many hats that I wear, but this is actually my hometown and where I'm from. I always like to recognize that indigenous land, Kingdom of the Happy Land in North Carolina in the Appalachian Mountains. My affiliation already stated, Black Alliance in Advanced Carolina. So good to be here. So a snapshot of what we have dealt with in North Carolina, as Maya mentioned, I'll start with narrative, and then we'll go into the populations and how we're looking at how we can incorporate in policy resource allocation, how we can begin to look at the data of cumulative impact, and how can we actually test the appropriate levels that should be within the bloodstream of environmental justice communities who are exposed, not just through drinking water with PFAS, but many other entry points. So for us, Hurricane Florence of 2018 was a very, large damaging storm for us, but it's not the only hurricane. I do want to ground that in 1980, DuPont, now known as Chemours, purchased 3M. And so what was happening was PFAS was already being leached into the groundwater upon that purchase. And this was in 1980. Okay. In 1984, we had two major hurricanes, Hurricane Fran, Hurricane Diana, and they came through. And what is common for our communities on the East Coast is hurricanes will breach this contaminated water across, miles of landfills, miles of corporations, miles of just businesses, homes, fields, farms, the like. Right? But it hasn't been elevated to the point of research and seeing how it has impacted our communities over the past 40 plus years. So we're catching up at a really slow rate of what that means for disparate health impacts. But to snapshot to Florence, to fast forward, in 2017, it came to state and national attention that, our Cape Fear River, our largest watershed in the state, had been contaminated. Chemours purposely dumped PFAS by millions and millions of gallons into our Cape Fear, poisoning the watershed that gives to 1 point residents in North Carolina. Up to 1 million folks are dealing with the impact of just coming into terms with, okay, my water is impacted, right, with this chemical contaminant. That was 2017 that communities started to grapple with this news. 2018, under a year later for us, hurricane season hits. We are at that point trying to move and evacuate, help support our folks, and we're not able to really grapple with what is PFAS, right, in that moment. So over 455,000 people were evacuated in Florence. Up to 11 dams were breached or failed, and over 75,000 structures flooded. So when we're talking about overhauling antiquated structures, we're also talking about the structures that have been contaminated by hurricanes that are carrying these chemical contaminants plus other pollution impacts. And of course, family farms. A lot of our communities are sustainable ag, family farms, and live off the land. That's been impacted. So the breach, let's look at just the kind of modicum impact. Coal ash. It was reported that we had coal ash in our water. We're very familiar with the fight of coal ash. Our former Secretary, Michael Regan, who's now the Administrator Regan, achieved the largest excavation of coal ash in the country. So we were aware of coal ash in the water. It was reported. We were aware of animal waste from large corporations such as Smithfield and other subsidiaries. We were aware of sewage, but what was not reported or researched was the level of contamination of PFAS in our breached waters. Okay. So again, for decades, this is 40 years of impact, but this is just a focus on one storm. So imagine the storms that followed and the storms that were prior. The landscape analysis for our state, okay? In addition to the contamination that was breached across our communities, over 35% of all North Carolinians are renters. Why is that an impact? Because for children, our largest source of exposure for our kids is the carpet, is through carpet. And so when we're talking about over 35% of North Carolinians are renters, when we are addressing, okay, how are we working in state around policy that includes affordable housing and AMI, and talking about these other policy and resource pursuits to make sure we're supporting communities, we also have to talk about the infrastructure that is contaminated. So we're moving communities into contaminated apartments or contaminated housing, and we're unaware in community, but specifically policy, that we also need to say, okay, what about the carpet? What about the infrastructures, right? And so 35%. For our communities in North Carolina, again, I said rural communities is hyper local. So how are we supporting, again, looking at the research being equitable, the outreach in areas that are dealing with broadband divide, broadband deficit? How are we really getting into communities that are dealing with food deserts as well as medical deserts? So why are food deserts so important? So 80 out of 100 of our counties, we have 100 counties, 101 with a Cherokee reservation, but 80 are considered food deserts, or portions of the counties are food deserts. This landscape here, this map, shows that the darker shade of green means that this is a higher concentration of population of folks who don't have transportation, that are at least 1 mile away from a grocery store in urban areas and at least 10 miles away from a grocery store in rural areas. Why is this important when it comes to PFAS exposure? Because our communities then have to rely on a fast source of food that is convenient and in proximity, fast food. So our communities are not only engaging in having to figure out, I'm in a food desert, I don't have transportation, let me go to this convenience store, or let me go to the local Burger King, let me go to the local Wendy's and the like. So for our communities who are not only accessing this consistent meal up to several times a day, we have franchise workers who, they eat their meal on site at their job. We have folks who are simply having a lunch break. If they're in food deserts, they will access fast food for themselves and their families. And so PFAS, as we know, is found in fast food containers. So we know that, McDonald's has made this commitment to, discontinue the use of PFAS. It is still going to take a few years. We have to consider the landfill and the groundwater leaching and what that actually means, and policy that when we discontinue the use, what is that doing to our landfills? Two, we know that 56% of all people of color in this nation live only 2 miles away from a toxic waste landfill. So if McDonald's and other corporations are going to dispose PFAS contaminated containers that will leach into the groundwater, we can already calculate in this need for research to do a landscape analysis to say, it's a high probability that it will leach in a community of color, because all communities of color, 56%, live within 2 miles of this landfill. Okay, we can already begin to think about all the cumulative impact that's to come. So this is just one snapshot. There's more up-to-date research that is continuously happening around fast food, but your higher concentration of PFAS is in the containers, right? In the wrapping, in the parchment paper and the like dessert and bread wrappers are high at 56%. Burger and sandwich wrappers, 38%, paperboard, 20%, and paper cups. For a lot of our communities, this is more of a, I'm giving you the data, I'm telling you the rates, but for our folks on the ground, what are they dealing with? We have many corporations, and I don't want to pick on McDonald's, but it is one that we've actually had to push against and really fight, because a lot of our mothers, expected mothers who were employees of this local franchise of different counties, were actually having high rates of miscarriage. And so we were, okay, what's going on? The high rates of miscarriage was due to being exposed on their lunch breaks and several times a day as well to this meal. It was convenient, it was cheap and expensive, expensive, so to speak, but it was a source of contamination that impacted how they were able to proceed in their pregnancy successfully. And so we know that 16 women, mothers that are exposed to PFAS and have PFAS in their bloodstream are 16 times more likely to miscarry. How are we looking and supporting our franchise workers? OSHA studies, definitely that's one of the, you'll see later in the slide, some of the recommendations as you're navigating how to apply these policies to your EJ communities is OSHA studies. How can we really look at that OSHA protection layer and what it means to begin to support workers that are in franchise, corporation, plant workers and the like, farm workers as well. But how are we doing that for expectant mothers? And so in North Carolina, over 481,000 of our folks work in fast food industry. So when we're talking about pathways of exposure, we also have to take into consideration research that allows the inspection of cross-contamination through multiple industries. So our folks, for example, in Fayetteville, North Carolina, Cumberland County, hyper focus here, when they are working at Chemours, part of their subsidiary, there is actually a neighboring plant, Smithfield, which is one of our large corporate farms, a large plant with pork production. Well, our workers that are exposed in the Smithfield plant are still being exposed to the same contaminants that our employees are exposed at the Chemours facility. In addition to that, the water that the pork product is being packaged in, and not only the water, but the package that the pork product is being packaged in is contaminated with PFAS. So this isn't just a hyper community problem. We are in North Carolina, the #1 and #2 largest pork producers in the nation. We have more hogs than people, 40 to 1. So when we're talking about we're packaging contaminated pork into contaminated PFAS water, into contaminated PFAS packaging, it's going to communities nationwide. It's going into homes and grocery stores, and the impact is spreading, right? And how are we tracking that data? And how are we really looking at that cross-contamination from multiple industries? And also, how is it impacting the workers who are in these varied broad spectrum of industries? What does that mean for support for them, especially in communities who are dealing with lack of insurance and affordable health care? So again, cumulative impact when industries collide. And I focus on the water that the packaging is in. I focus on that because that was actually downstream source contamination for us where the PFAS was dumped. But we don't want to forget the air emissions and the long-term impacts on health for folks packaging the products, but also receiving them. And so we need to test exposure and make provisions for those closer in proximity and more consistently exposed to this emerging contaminant. And so that is another resource need, but another research need. So these are some of our high priority populations. Okay, you've already heard me kind of elevate expectant mothers and the fact that mothers who have PFAS within their bloodstream up to a certain limit are 16 times more likely to miscarry. But in addition to that, PFAS can cross over the placenta. PFAS can be passed to the infant through breastfeeding. We're seeing, of course, more and more recent studies, but a lot of our communities were already aware of this because of the large incidences of miscarriages in our communities, the lack of insurance and clinical guidelines. It was hard to support folks in their prenatal care. Also, the tracking of testing for mothers who do give birth. What about the survivability of that newborn? What about the support for that mother as she may navigate into breastfeeding? What does that mean? To research and to set a parts per trillion and a limit within the bloodstream that both the mother and the infant can have, right? So we need to look at the cumulative impact of 2 individuals and a child coming into the world that's already contaminated with a pre-existing health condition. So I'm throwing in all these kind of policy language, but also the focus of what we're dealing with. And again, that's why I included, followed by the need for adequate medical care for the expectant parent and and child. And this is also increased infertility concerns among men. And so that's another issue, expecting mothers, but the increase in fertility for our men. So returning citizens. In 2018, there were 35,000 plus people in North Carolina prisons. And so as we're looking at those populations, this is high priority. What is the testing and the equitable outreach to the facilities to make sure they're resourced with the appropriate funds to test their water? What exactly is the impact on the population that is in confinement? And so also in addition to that, the blood testing for individuals in custody of law enforcement, blood testing and clinical support post-release. So how are we tracking this data over a long term to support your local governing bodies, your state governing bodies in assessing this population and how they can successfully reintegrate back into society and contribute? How can we do that if we're not following the impact on their health, right, for being exposed to confinement facilities? Clinical guidelines for free clinics and urgent cares. This is another impact. So if we're talking about EJ communities and the clinical guidelines, how are we also making room for free clinics that many returning citizens, attend or visit due to the lack of insurance and getting back into community? So free clinics and urgent cares and that support. So clinical guidelines are there as well. This is not often included in outreach for community input or testing. Another high priority population is communities living with disabilities. So I mentioned earlier that North Carolina, over 35% of all of our folks are renters. Well, for us in our state, 18% of total extremely low income renter households are communities living with disabilities. These are also the same communities that oftentimes overlap in rural communities who are drinking unregulated utilities or on well water. They're also in unincorporated towns and municipalities, and they're located in food deserts. So convenient, they're exposed to convenient food sources, if it can be delivered to them, and other accessible pathways to just everyday life. How are they being impacted with these cumulative impact, but also as renters, what is the infrastructure contamination and the water viability? So with that, exposure to PFAS through food supply, carpet and manufacturing materials is already stated. And how are we talking about accessibility and accommodations built into blood testing outreach and research for this population to know exactly their impact? Three more high priority populations, and I'll begin to kind of wind down and go into recommendations. Firefighters. We are in deep partnership with firefighters across the nation, really honored to fight alongside heroes and the spouses of these heroes. And we're also in conversation with firefighters from Canada and just talking about how are we really creating a unified vision for fighting back against this contamination. And so firefighters, the lack of testing options for us in the state or studies for firefighters exposed to PFAS and AAAS foam. This year, we are in coalition. We introduced a bill in the legislature that is addressing this firefighting foam. And in trying to build on previous legislation to say, okay, we need to take it a step further. And let's also include next time hazmat. So we're talking about firefighters, but also when you're talking about these high priority populations, hazmat certified heroes can oftentimes have 50 to 70 buckets of PFAS contaminated AAAS foam on their truck alone in comparison to 10 to 12 buckets on a standard firefighter's truck. So you're seeing the impact of firefighters and having to also research and support certified firefighters in hazmat. Again, clinical guidelines for healthcare providers is essential. Some of the things I really want to ground with firefighters is, cancer caused 61% of the career firefighter line of duty deaths from January 2002 to March 2017. And this was, of course, the IFF, so the International Association of Firefighters. Cancer caused 71% of IAFF line of duty deaths for career firefighters in 2016 to 2019. And so when we're talking about the hyper focus of firefighters, they're about to add 252 names to the wall to remember these brave heroes. And so when we're talking about, 80% of these cancers and these deaths were occupational. So we're looking at the overlap of the type of cancers that firefighters are dealing with, overlap with what we've seen PFAS and the impact of alleged impact on cancers for our folks, from testicular to kidney and the like. Living in care facilities and alternative housing. This is similar to confinement facilities, but a different population. For us downstream, we did analysis, of course, there are 27 senior living care facilities that house over 2,000 residents downstream. So when we're talking about consent orders, and so right now in North Carolina, we have a consent order that was achieved through an organization called Cape Fear River Watch. Really honored to be a new member of the board of directors, but that consent order has set the standard for Comores being required to test certain facilities, including schools, and to provide alternative drinking water as they remediate this impact. But the issue that we need is the consent order, and the language needs to be a bit more broad. Because it actually, included only a few schools and a few facilities, so 2 to 3 schools out of over 42. So you can think about how we brought that. And so I'm about to wind down.
And let me just to cut in, I know you have 2 kind of slides with recommendations. I wonder if we could shift to that now, just in the interest of time. Thank you.
Sure. So when we're talking about suggestions, right? So again, these are pockets of, and I'll call them pockets or buckets of the many layers of cumulative impact. So how are we supporting rural communities and urban communities? So medical deserts, lack of diverse healthcare options. Some residents drive up to 23 plus miles to the nearest emergency room. Communities on unregulated utilities and in unincorporated towns face PFAS impact in well water and groundwater. And the impact on our property, our family land, and wildlife has been immense. A lot of our urban fishing, our striped bass have been impacted in the water. Our clams have begun to disappear, and that is affecting the livelihood and the health of our communities as they access again, their livelihood. The lack of insurance coverage similar to rural communities. This is urban impact, lack of clinical guidelines, and how we're working with our local universities and again, national academies as some of the focus. Double exposure to air emissions and public utilities, and increased exposure to fast food, an impact on urban fishing, as I already elevated, on contaminated areas. So 2 recommendations. So this first is federal, and then we'll go into state hyperlocal. So when we're talking about such federal relief as what potentially could be the American Rescue Plan, we've seen the term climate justice incorporated as language in this infrastructure plan. So what does that mean? To expand climate justice, how can we really use money for that? How can our states, you all, begin to resource climate justice? A part of that can be resource support for contaminated communities. Redefine infrastructure to include remediation of toxic exposures in buildings, community centers, pipes, housing, farmland, fire stations, and other community infrastructures contaminated by PFAS, or like I said at the top of my PowerPoint, the impact that hurricanes can create on infrastructures. Redefine that infrastructure so that there's additional resources for your states to be able to address remediation from toxic exposures. Resource support for military infrastructures, base housing, schools, and daycares in proximity. As a former Air Force wife, this is really huge for us because we lived on a very contaminated base. Conduct research in environmental justice communities and low populations to assess contamination depth and spread. This could be a part of that funding resource allocation from the climate justice funding source of the infrastructure plan or other federal plans that include that term climate justice or environmental justice. And in that navigation, also explore resource needs to connect PFAS exposures and COVID boosters and how vaccine viability is impacted in an adverse way by communities who are exposed to PFAS. And what does that mean long-term for your communities, whether the vaccine works the way it needs to for our folks to be healthy and to survive. For a more localized snapshot, what our communities need. Our communities are absolutely willing to undergo testing. It's the messaging, it's the invitation to participate in the studies, and to that inclusivity, right? And so we can, at a later time, can always give more feedback on what that looks like, but communities are absolutely ready to be tested. So when we're talking about us, larger assessment and testing, we need to assess a larger sample size, seek funding and make funding available within policy, and that can include the state budget, that can include the other data that was elevated in the previous presentation. Track data over the long run. Blood exposure is a tipping point of health outcomes. What's the tipping point for babies and expectant mothers, for EJ communities, and should EJ communities be tested differently than the standardized being elevated, being that they are exposed, again, to many pathways and cross-contamination in multiple industries? we should be including clear testing for healthcare providers and for insurance claims. How do we support folks with getting that insurance coverage? Because insurance right now in certain areas will not cover actual PFAS testing in the blood. And of course, I've already elevated this. OSHA studies on fast food workers within your states, plain language for both urgent care and free clinics, and better representation of design for better health study effect study data. If the community can't participate, this study can't have data needs properly assessed. And in the health outcome, last thing is factoring the appropriate parts per trillion to increase survivability because of the exposure to COVID-19, other environmental contaminants, major industries, and many EJ communities are dealing with other pollution sources, coal ash, wood pellets. It runs the gamut. So how are we really looking at the parts per trillion in relation to the other impacts that communities are already facing? And so that is me. This is my email address. Please feel free to reach out with any questions, and we could go through definitely questions in this next section. One recommendation I would say is Purdue is, I think, done a really phenomenal job with the recent studies that they are conducting around rural water testing, biodiversity, and how it's impacting wildlife and fisheries, and also how our environmental communities impacted with landfills. So that's some recommendations already. And thank y'all so much.
Great, thank you so much, Lamicia. I mean, it was a ton of information and really helpful to hear you kind of highlight those kind of specific communities, populations, sources, and then I think those recommendations at the end are really helpful as well to kind of help folks on the call today think about, okay, so what can I do? Where can I focus my attention? So thank you very much for that. We are running a little bit short on time, and so I see you're putting your contact information up there. So thank you. I know at least one person has asked for that in the chat. I think we're not going to have time for questions right now because I know folks want, we have these breakout sessions, but I appreciate you putting that contact information up there so folks can get in touch with you. And thank you again for sharing this presentation. There was one question in the chat just to draw your attention to related to people living near landfills. And so just if you want to take a look at that in the chat and clarify.
Sure, thank you for that clarification. So it's considered toxic waste hazardous sites, but most of our communities in the South are landfills. So I did want to say absolutely that correction, toxic waste hazardous sites. Thank you.
Great, thank you for that clarification. Okay, so our next, as we've kind of teed up here, as we went through the agendas, and I've been saying, just speaking about, we are going to move to breakout sessions. And so we do have 3 breakout groups that we'll be dividing into. One is on biosolids, PFAS and biosolids. One is in destruction and disposal, options for destruction and disposal of PFAS, and then another one on pollution and prevention. And each session will have a kickoff speaker. We're really grateful for Anthony Druin from New Hampshire, who's offered to share a few opening remarks about biosolids. Julie Woosley from North Carolina, who's offered to share a little bit about destruction and disposal. And then Barbara Morrissey, who we've already heard from, and she's going to speak a little bit more about pollution prevention. So I'm going to ask Jordan to go ahead and pull up the tool that lets people move into their breakout groups, and we will rejoin at 3:55 back in this main room. Thank you. In my group, we ran out of time, but I was in the process of saying I think there were a lot of kind of questions and I think there were a lot of questions highlighted, places where there's more research or information needed, and so it was really helpful to hear some of those. And I'm not sure if the same was true in the other breakout groups, but really glad to see everyone back, and appreciate again our kind of kickoff speakers for the different sessions, Anthony, Julie, and Barbara. Okay, so as we are wrapping up here, just wanted to take a few minutes to just say thank you everyone for participating. We did ask you to fill out that poll earlier in the session, and I'll ask Jordan just to put that up on the screen here in the last few minutes that we have, just so you can see the results and what folks indicated were some other areas that they wanted to learn about more from other states. And with that, I think we're going to hear a few closing thoughts from Rebecca and then Jessica. And one of the kind of last comments that I'll make before I hand over the reins to Rebecca and Jessica is just to say thank you, everyone. We are going to put an evaluation survey in the chat, and so ask you to look for that survey. We welcome and really value your feedback on these sessions. And thank you again to all the presenters and participants. And with that, I'll turn it over to you, Rebecca.
I will be very brief and just say thank you all so much for attending. We at the Epicenter are here to help bring scientific information and talks like this to all of you. I see in our poll, there's a lot of interest in the state MCLs as well as all of the above. So we hope that we can continue to work with the National Governors Association and all of you to address these questions that you still have.
Thank you, Rebecca. And on behalf of NGA, I would like to thank all the speakers and my colleague Bevan, along with Rebecca and Resolve folks for helping organize this meeting. At NGA, we are here to help governor's advisors. I know there's a lot of health and water folks on the line. If you have kind of questions in particular about what other states are doing, need any kind of research or other kind of policy analysis, we're happy to help. You can reach out to me or my colleague Bevan Buchheister. Are going to also be continuing to talk through any kind of future PFAS work in the next couple of weeks. So if you have kind of thoughts or ideas on what would be helpful for all the state folks on the line, please let us know. We will, after this meeting, be sending out the final kind of recordings and presentations next week, along with some other materials we collected that different state participants asked for. So thank you so much, and would love your feedback. And then I know Erin from Resolve threw a survey in the chat. If you could fill that out, that would be wonderful as well. Thanks again, and bye everyone.